Today is Sunday, March 25th, 2018. This is Journal 11. This journal is about what should be in a well-stocked medical kit and emergency supplies that should be on hand for the sport that I'm currently with, and why do I believe that these items are important. So, I actually made a list. So there's a lot of things. I know that right now, because I'm an underclassman in the AT program, I have a smaller kit. So I just did it like as I would have a large kit like a certified would, because we can't carry much in ours. So things that would not be in the kit but we need would be a bag of splints. We need our AED, spine board, and straps with a C-spine collar. That helps us with transporting. The AED would help us if anyone wanted to a state where they were unconscious and didn't have any heart rhythm. C-spine would be for immobilization. This bag of splints as well. For our medical kits, there's a lot of things. So I just started off with the things that are in mine right now, which is tape. So I have Powerflex ultralight, adhesive tape, any kind of size. I have triple antibiotic, ibuprofen. I have a variety of sizes of band-aids, lots of gauze, cotton swabs, gloves. I have a little thing of Vaseline to help with to stop bleeding. Also, you could carry heel and lace pads with Vaseline in them as well. I just find that kind of makes my kit dirty. Lots of gloves, I think I said that. Hand sanitizer, any personal medication like EpiPens or things along that lines for the specific athletes. I also have some sunscreen in my kit. You would also need scissors and tweezers, and possibly, a sharp tool to get ankle tape off, wrist tape. Pre-wrap also goes in with that. Adhesive spray, a thermometer would be helpful. Alcohol wipes would definitely be helpful for helping with infection and sterilizing things. I also have a couple butterfly strips, just to kind of pull like places together, and places that are a little deeper that just need more than a band-aid to help with healing. A triangle bandage or a cravat you can have. They're not very, they don't take up a lot of room, but they're very helpful. You can make a sling. You can help with immobilizing things, tying things together like your legs together, or tying your arm to your chest. Also, a couple SAM splints would be helpful. I know in our bag of splints we have like the rigid splints. I think we have a couple of the air splints. A-straps are helpful because if someone has a groin issue or muscles, like a strain issue, and it starts to loosen up, you don't have time to re-roll it, so having extras would be important. A biohazard bag to put in the things that have bodily fluids on it. You could carry cold packs, but with us we usually have a chest of ice with bags and wrap. So if you didn't have that, then you would need, I guess, wrap and cold packs. I think honestly it would be helpful to me to carry around a copy of the emergency action plan. I know with the sport I'm with, which is baseball, it's posted right there in the dugout where we preside during practicing games, so that's helpful. There's people also carry finger splints, so there's that. Blood busters, so if someone else's blood is on them or their own blood is on them and they're allowed to, and we clear them to go back into play, then they need all the blood off their uniforms, so we need that. We also carry some hydrocortisone cream, like Theragesic for like an icy hot type effect for muscles. We also carry Biofreeze. Sometimes we carry antihistamines for people with allergies, especially traveling to other places. Allergies act up. Saline wash is important for cleaning out wounds, helping get something out of the eye, things like that. We also I carry a couple antacids, so Tums and stuff for upset stomach. I think that you could carry like laxatives. Also, we have like, I think it's called Diatome. It's basically an Imodium, and cough drops. There's a large variety of things that you can carry in your med kit that we need. Just you have to be prepared for the worst and the things that happen the most. Obviously, with baseball, it's a lot of, you take my wrist, can you take my thumb, I have a headache, I have a runny nose, can I have some allergy medicine, can I have some hand sanitizer, I just got dirt all over me, sliding into base and everything like that. There's a lot of rocks and things that can get into your skin, so saline wash, cleaning stuff out, covering things up. Also, people get hit with the baseball, which would make us worry, so we have the AD and things like that. When people slide in, they can slide in incorrectly or hit the base, and there could be a fracture or dislocation to an upper or lower extremity. So we have the splints for that and the spine board because it's easy to transport with that. There's a lot of things you can carry. Also, I find it very helpful to carry a sticky note and a pen. So if someone does ask for medicine, you have date and time, name, because we don't carry our book around with us. So if you do dispense that medicine, you need the lot number and all that, the medicine and the numbers off of that, the dosage, person, date, how much you gave them. So I carry around a pen and a sticky note. But I also carry some little like lip balm or chapsticks. I know that when I was with women's basketball and men's basketball and volleyball, I tend to get really dry in the mouth region, or their nose get chapped. I know when softball moved outside, very chapped because it was cold and windy, so they didn't want Vaseline, they wanted the lip balm, so gave them the lip balm. But yeah.